Stitt, to talk about the state's readiness for COVID-19. Governor, I know you haven't talked at all about it. I know you just had a press conference. Tell us, what is the readiness of our state?
You know, we're really trying to follow the guidance of the CDC and the federal administration. So we've been on constant contact with the White House, the health officials there, and it's rapidly changing. I mean, this thing has been moving at rapid speed on their recommendations in our state. We feel like we're ahead of the curve. So what we're doing right now is we're recommending kind of some social distancing. So we're recommending that folks no more than groups of 10 or more get together. And we're really just trying to flatten the curve out so it helps our healthcare system, which I'm excited to talk to you about. I've been in constant contact with restaurant owners, hospitals, the association there, our pastors and nonprofits. People just want to pitch in and want to know what they can do to help. We've taken our public schools and we have a canceled class for 2 weeks after spring break to give time for some deep cleaning of the schools and also to kind of try to spread this thing out a little bit. I've talked to our National Guard to get them prepared in case we need to stand up other facilities. We're looking at the supply chain. We're looking at propping up some extra testing facilities around our state. We've talked to FEMA about getting some mobile units here. But right now, and that's what my press conference I just came from, there is a shortage of test kits right now. And it's nationally, it's happening. So I've been on the phone with our federal delegation, letting them know that they need to pull every lever they can to make sure Oklahoma gets the test kits that we need. And so this is I know Oklahomans are anxious and fearful, and what does this really mean? And I'm actually anxious to talk to you about, you know, from a medical perspective, what can we expect? But Oklahoma is doing everything that we can right now to mitigate this the best we know how, or from the recommendations from the federal government.
And many of the items you've brought up, we're going to talk more specifically about. The first that's very important is what you just said, communication. We've got to get anxiety and the fear of the people in Oklahoma calmed down, that things are underway, things are being done, and getting accurate, important information out on a regular basis, I think, is very important. Are you willing to, either you or somebody close to you, go on television each day to give an update? Updates are essential. People don't always read. They don't hear radio announcers or even programs like this. But if they know that at a certain time, Governor Stitt's going to be on TV to give us a 10-minute update, I think that would be vital.
We would absolutely be willing and able to do that. That's the thing, is how do you communicate to all 4 million Oklahomans? And we're trying to do that through either radio or programs like this, or television or Facebook, or so there's just a lot of mediums that we can use, and trying to get that perfect one that can hit the audience. We're all for that. One thing I left out that I think is important, our grocery store association, they've come together, we've innovated, and we've decided they've decided let's be open 1 hour before the general population can come in, so our elderly can shop. And this is important. President Trump wanted me to remind Oklahomans that there will be no disruption in our supply chain. The manufacturing, the distribution, the big box stores. There shouldn't be any need, and this is one thing that they reiterated and wanted me to let Oklahomans know, no need to stock up for 2 weeks or a month. We will have the supply chain rolling.
We won't run out of toilet paper, that's for sure.
That's right.
Okay, that's important. Right now, what we're seeing is a doubling almost every 2 days of the numbers. 29 positive cases, more than 100 cases pending in the state of Oklahoma. We now have had our first child, less than a year old, positive for COVID-19. At this point, testing is critical. Yet, I talked with the Department of Health today. After the runs today, they will have less than 50 kits available to them. Obviously, that's not anywhere near what we need. Is this going to be a partnership? Is there discussions with the private labs to try to increase the number of testing we can do daily? And is there anything the medical community or the private community can do to help obtain these kits? Or is it strictly a bottleneck at the federal level?
Well, on the private labs, we've approved 3 private labs in the state of Oklahoma. Commissioner Cox is on the phone with them as we speak, and I haven't got an update yet of how many test kits they have available. That's something that I'm very interested in learning. The other thing, I've got on the phone with our research universities. We've got some really, really smart scientists, and I've really pushed them, hey, let's figure out how to create these test kits ourselves in our state. There's the reagent that we're missing right now. University of Michigan, some of the research universities in that state, they're a couple weeks out, they think, from creating their own test. And that's something I've challenged our research universities to do as well, just in case this shortage continues or it gets worse towards the summer. I want our folks working on that right now. I'm being told that the private labs are having the same issues getting those chemicals from the few manufacturers that do it around the world. There's just such a supply on it or demand on it right now. The supply hasn't been able to keep up, but we're on it. I know our federal delegation's on it. I had a call with them yesterday, Senator Inhofe, Senator Langford, our Congress men and women. I've said, listen, you have got to pull every string you can to make sure Oklahoma gets the test kits that we need.
I will tell you, if you're not aware, the University of Nebraska has their own testing. They don't use the federal. They develop their own, and they have made it public that they will share. So I don't know whether the state of Oklahoma has contacted the University of Nebraska, but they do have their own test that is very reliable.
Well, we were on the phone. We knew that too. We had our people at the Department of Health contact their department to figure out what they're doing. And it's my understanding that they figured out a way to, I guess, make their tests go further. So basically, they're taking 5 samples, and then they're using one test kit. If all 5 are negative, then all 5 are done. If one of them tests positive, then they know they have to test the other 4. So they're just doing a statistical analysis to stretch their testing kit. So I don't know if they have more tests or unlimited or different. They just have a way to stretch their everyone's limit, and that's something that I'm challenging our group to be thinking outside the box like they were doing.
Once we get adequate testing, whatever, through private, through the state health, will you encourage or order drive-by testing so that people aren't going to doctors' offices? Right now, the private labs, the ones that I've talked to, say you go to your private doctor, they have the swabs, they have the media, they do the test and send it to the lab. Well, that's putting people who are infected going to a doctor's office. Obviously, that's not a good thing. Secondly, only the minority of doctors are going to have the nylon swabs. Cotton swabs on a wooden stick don't work. And most doctors like myself who aren't primary care aren't going to have those, and yet we have no way to get them, so we can't do the tests for our patients. Is that something, drive-by testing, something that is at least in the plans?
Absolutely. The 68 test sites that we want to set up around the state, we've talked to FEMA about getting 2 mobile test sites in Oklahoma. The University of Oklahoma has already started working for a mobile site here in Oklahoma City and Tulsa. But the problem, we've kind of trying to figure out, when do we just start collecting those samples but yet have no way to test them? So it's kind of a chicken and the egg. We want to get those test kits here, but we're ready to pull that lever and get those mobile drive-by sites set up. We've got that ready to go.
If we have the drive-by sites, the private labs could potentially do them. Now, you're right, they may be out of reagents, but at least Quest is saying that they still have, and I don't know what the capacity is, and that's an important number to know and to get out to the public. That's part of the communication part, and certainly you're doing all the right things, but we need to get the information out so that the public and the medical community is aware of it. One of the critical areas, as you have already alluded to. The CDC said now less than 10 people, keeping social distancing of 6 feet. Our restaurants have been an issue. The mayors of Oklahoma City, Tulsa, and Norman have issued a proclamation or an order to close. Will you do the same for in-restaurant dining for the rest of the state?
You know, I'm not going to do that right now. I'm following the CDC's recommendation, and if the CDC changes and recommends that we close all in-store dining, then I'll consider that. But right now, I'm telling our businesses, our restaurants, to innovate. Let's focus on curbside delivery. Let's focus on delivery. Let's move let's spread out. Let's make sure we're not together. I'm really clear. Hey guys, businesses, everybody. I don't want to restrict business. I want us to innovate, and I want us to listen to the recommendation of the CDC. Because there's it may be different in Lawton or Altus or Enid or Guyman than it is in Oklahoma City or Tulsa, and we may not have communal spread in those areas yet. So I'm really leaving that up to the local mayors to decide.
I think that there's going to come down to being really 3 points that we're going to address today that are important. Communication, we've already talked about. Testing, we've already talked about. Responsibility. People have to be responsible. We know that hand washing, we know that avoiding crowds, we know that keeping a social distance, we know that not touching your face. All those things are vital to trying to blunt the peak of this virus. Despite all of that, we're seeing worldwide increasing numbers in the United States, certainly, as well as in Oklahoma. There's going to be an economic impact. We've already seen an economic impact on our stock markets, possibly the oil business. Can you talk a little bit about what you feel the true economic impact is going to be on the state of Oklahoma?
You know, it's going to be significant if this thing keeps going for any length of time. We're already hearing of the layoffs, especially in the hospitality industry. We're already hearing about hotels struggling, restaurants struggling. I'm having our team, our unemployment fund, we're shock testing that to see if we have 4% or 5% or 6% unemployment, what does that do to our fund? I'm talking to our federal partners about the stimulus package to make sure that they help us replenish our unemployment funds. I'm trying to waive the 1 week wait time to get some of those dollars back into the hands of the folks that are affected. We're looking at a potential revenue shortfall for fiscal year 2020. We had budget meetings today on that. We're looking at a potential also another kind of recast for fiscal year 2021, which is what we're in session for right now. So it is going to affect our budget. It's going to affect us a little bit. Then you've got the federal government has decided that the tax returns are due April 15th, but nobody has to pay until 90 days later. So those remittance will affect us a little bit, and then we may, as a state, need to do that to help out some folks. So the collections will definitely be down. We also oil and gas right now. We don't know what that pricing is going to do with this. So I don't have an actual number, but we are being prepared and we're ready. This is the reason that last year I forced us to save an extra $200 million. If we wouldn't have done that, and now we have the largest savings account in state history, we would be in a world of hurt this year. So those are some things that I'm thankful that we were fiscally responsible last year to make sure we smooth out the earnings, we smooth out the expenses coming into this year too.
Well, that was going to be my next question. We all realize there's going to be an economic impact. Some have said as high as a 20% unemployment. We're going back to the 1930s to see numbers like that. if needed, would you be willing to dip into your rainy day fund, which is the highest it's ever been, rather than trying to increase the savings?
Oh, absolutely. Yeah, I'm planning on dipping into that because my whole goal with protecting and putting a savings account is so we never cut core services. When we do, we can do it less than you'd have to without the savings. So that's absolutely what it's there for. It's to smooth out earnings. It's to smooth out expenses. It's what any business person would do that saw what I saw last year with the budget surplus. I said, listen, the best time to save is when we have budget surplus because revenue doesn't just always increase every single year. And here we are 12 months later facing this situation. So that's just good responsibility. I'm so happy we did that last year, and we just it's going to be very fruitful for our state that we were fiscally responsible last year.
And
when am I going to get to
that.
ask you some questions?
We've got a few more to go here. We'll let you ask in just a minute. But two real questions that I have right now. One is, there's a chance, if we don't blunt the peak, that this will overwhelm our medical community. Hospital beds, ICU beds, ventilators, all of that. Does the state have a plan to either, as you said, use the National Guard to build facilities, to put up tents? Some in New York have already done that. Do we have that plan in place? And if so, what will it take for you to initiate it?
The answer is we're laying those plans right now. I mean, I spoke to the National Guard today, General Thompson, and I said we've got to have a plan that if our hospitals are overrun, what are we going to do? And so we're building that plan as we speak. I was also on the phone with the CEOs from the major hospitals around the state today, asking them for their surge plan. And then I wanted a map, which my team is working on, that has all the beds and availability, ICU beds, critical care beds around the state, and then also just kind of a hot spot of where the cases are to make sure we're prepared for this. So we have there's some hospitals around the state that have closed that we're looking at. There's Tinker Air Force Base. There's the fairgrounds. There's tents. There's other things that we can do. By me signing the executive order, it also released some regulations for hospitals to put some surge plans together and some other space where they can create some other critical beds. So that's really the issue. If we do have a huge spike here, and this is what we're trying to flatten this curve, but if there was a big spike, it's going to be the ICU beds that we need. I'm also asking the hospitals to consider some of these non-essential surgeries for them to wait on some of that. So I know that's things that the hospitals are doing, and we're postponing some of that to free up beds. But the thing is, the National Guard does not have respirators. They don't have a lot of the hospital beds. So we have to start thinking about those things. How do we get more of those supplies? And that's what I'm pushing my hospitals to take an inventory. Let's see what we need to do, and let's coordinate that. We have a state supply of masks, and the health department keeps for a strategic supply that we're also getting an inventory there. And it looks like I'm going to order that to be distributed around the state and get it ready and get it into the hands of the hospitals as well.
So in talking just now, you have not activated the National Guard because there was a rumor that in Lawton at Fort Sill, the National Guard had been activated.
That is not. I have not activated the National Guard.
Okay. I will say, and I'm proud to say, I'm a member of Digestive Disease Specialists, as you know, a large gastroenterology group here in Oklahoma City, and we have closed our endoscopy units, all of them, as of 5 o'clock today. They'll remain closed for the next few weeks. I know I was scheduled to have surgery, elective surgery, tomorrow. That has been canceled. So physicians are trying to do the right thing by canceling elective cases. The hospitals, I know, are trying. This is an important question. Have you considered forming a COVID-19 task force to include the healthcare providers to advise you on a regular basis?
That is something that we haven't done yet. We've considered that, and I will get back with my team on that tomorrow.
I will volunteer OSMA to be a part of it. I know that
sounds like I've got my chairman right here in front of me.
I can tell you that all of the medical community is eager to pitch in and help.
Thank you.
We just need direction. We need communication. So that's real important.
I think that's a great idea.
You know, I know that the State Department of Health has a 24/7 call-in line. I think that number is on the screen, although I don't see it. Oh, okay. It's up top. There it is. Don't have my glasses on. But that's an important number. I want to give that over the air. 1-877-215-8336. I also want to say that OSMA is working with the Department of Health to man that, and that we are putting volunteers, and we have asked for retired physicians to come back. So any retired physician who hears this, please call the OSMA. We'd love to have you man one of the phone lines. Medical students, residents, we're trying to get any physician who is willing to call the state medical. OOA is certainly going to be a part of it as well. So we are trying to help.
That's wonderful.
So one of the last questions, and then I'll let you ask questions. But we've talked before when we were doing Medicaid expansion, improving healthcare in Oklahoma, all of that, we talked about telehealth. CMS has come out with a relaxation in some of their rules to allow physicians now to do telehealth so that we don't bring patients into the office. Does the state see expansion of telehealth both for physical diagnosis as well as mental health, and the reimbursement being at comparable levels?
You know, I think that's something that through this experience, we're really seeing the value of telehealth. I certainly am. And in my press conference today, I mean, that's what the CDC's guidelines, that's what our guidelines for the state is. If you feel sick, you need to first thing you do is you need to call your medical professional or call our 800 number there on the top of the screen. That's 877-215-8336. And most of the people that get this virus, it's going to be mild symptoms, and they're going to be recommended from their health professional to stay at home, to get plenty of fluids. And if the symptoms progress, then that's when they're going to tell you to go into the hospital. So they take you through a list of questions. And so we think that the telehealth is telemedicine is something that's it's going to be more and more used and more accepted. As far as the medical reimbursement rates, sure, that's something that our healthcare authority is looking at in this situation. And obviously when we get into reimbursements for our rural communities, I think that's something that we certainly want to push for more provider access to our rural communities.
And I absolutely want to applaud the healthcare authority. They have reacted quickly. They have changed some of their structure to allow telehealth, and they've communicated to the physicians. So they need to be applauded and certainly given all the accolades for acting quickly. This is important for not only the patients to be able to get medicine through telehealth, but we have to keep our healthcare providers well. And if they're being exposed constantly, the chances of them getting sick is much greater. And if we start losing intensivists or pulmonary doctors or any of our primary care doctors, that's not going to bode well for the state.
Absolutely. I mean, when I was on with the hospitals, the other thing that they were concerned about is child care for the healthcare providers, for our nurses and our doctors and the LPNs and all the staff there. they have lives and families and children, and now with the schools being canceled. So then I was on the call with the pastors and the nonprofits and the churches around our state, and they're wanting to know how they can help and they're setting up child care centers in their churches to provide support for the healthcare profession. So it's great seeing how our communities are coming together. We put our DHS department on our Be a Neighbor site. So I set up a beaneighbor.com, beaneighbor.org. I think it goes to the same spot. Has the licensing requirements and kind of the fast track to get that child services set up to help our healthcare providers.
I think that right now communication has to be number one. I hope that you will seriously consider doing just a morning spot somewhere. Anything you do is going to be tweeted, texted, Facebooked. It's going to get out there.
Yep.
But if we do it daily where people know that they can get accurate information, there's a whole lot of wrong information being spread and a lot of rumors, which only makes people more anxious.
I agree. And that's what I want Oklahomans to know. We are going to get through this. We are doing everything that we're supposed to do to mitigate the spread of this. And Oklahomans are stepping forward. The business community is letting their folks work from home and telecommute. And I'm hearing stories all over. They're spreading their cubicles out and spreading the space, and people are elbowing instead of, high-fiving. And so that is really going to help. And then our restaurants, again, they're being very innovative, and so just couldn't be prouder of Oklahomans on how we're responding to this. And then we're also a faith-based state, and we're going to continue to pray for the welfare of our folks, and that we'll continue to have the hospitals respond like they are. Am I going to be able to ask you a few questions?
Go ahead.
Okay, here we go. Because my team gave me a whole list of questions. I want to get to like two of them.
Oh, okay.
So let's talk about COVID-19 from a medical perspective. How does this compare to the common flu?
So COVID-19, number one, is not affecting as many people as the flu has. It's not been around for as long as the flu has. Right now, the infectious factor for COVID-19 is greater than influenza. And most importantly, the mortality rate, which is somewhere around the 2.5% to 3.5%, and it depends on what statistics you're looking at. But if you say 3%, it's at least 10 times and maybe greater more deadly than influenza is. So while influenza has affected more people, tremendously more, and more deaths related to influenza, this has the potential to be worse.
The medical community is really stressed that people need to call the doctor first when they're feeling sick instead of going to the hospital or the emergency room. Can you explain why this is important for Oklahomans to follow?
Absolutely, and that's an important point. I should have actually asked you. But the most important point I can tell people right now from a medical standpoint is do not go to the emergency room if you only have mild illness. If you have a low-grade fever and you've got a cough, you don't need to go to the emergency room to be tested. They're not going to be able to do it anyway. As you've heard on this program, we have a shortage of tests at this time. Stay home, isolate yourself, do good hand washing, avoid family members. Household cleaners, cleaning surfaces will take care of the virus, and that's important. Don't forget to clean the knobs on the doors. People forget that. And your cell phones. Those are two areas that the virus can sit on. We know that it will last for various times. 4 hours on steel, up to 2 days on plastic. So cleaning all surfaces with a 409 or whatever the household cleaner you use is important, and isolating yourself. If you go to the doctor's office, you take the potential of infecting other people. We want to isolate this virus so that we're not spreading it. Doctors' offices, hospitals, emergency rooms, they need to be held for those that are sick with normal medical problems. We still have people having heart attacks. We still have people breaking extremities. Those are places where we will use our emergency rooms and our hospitals and save our beds for the critically ill. Those patients who are markedly short of breath, who are having difficulty breathing due to pneumonia or a virus, they need to go to the emergency room, but not the average patient.
Excellent. You know, when you take the number of deaths and the number of positive cases, you divide them, you get to that 3% level on mortality rate, and then you're looking at other nations. On the other side of that, I've heard people talk about, well, there's really way many more cases that haven't been tested positive, and so some people are arguing we don't know what the true mortality rate is. What would you answer that? How would you answer that?
I'd say they're exactly right. We don't know. Unless you test everybody, you don't have the denominator. And without the denominator, nothing you do statistically really matters. What we know mainly from China, where the biggest numbers were, and we're getting numbers from Italy as well, but 3%, 2.5 to 3.5 seems to be in the range, but we've had some reports as high as 6.8%. So it varies depending on country and depending on how good the numbers are. If you don't test everybody, you don't know the denominator and you can't determine a percentage. That's why, to me, why I brought up earlier, it's critical that in Oklahoma, in the United States, we have the ability to test everyone, not just the critically ill.
Very good. Have you ever seen anything like this before?
That was going to be my first statement. I've been practicing a while, 40 years now, and I've never seen anything like this. I grew up in the polio era. It affected a lot of people. They're talking about that this goes back, as far as the early 1900s, when I think 1918 was when the influenza outbreak was so deadly. We had no vaccine in those days. But we're going back 100 years. This is the worst health crisis, both nationally and internationally, in the past 100 years.
And can you explain to a medical professional that maybe is listening
infection? This is not something you're going to get from your air conditioning or from air vents. This is something that comes from coughing and sneezing, and the droplets that come with that carry the virus. And studies have shown that when you cough or you sneeze, the chances are that it won't go further than 6 feet. So by keeping a 6-foot social distance, somebody can cough or sneeze and transmit the virus to you. The other thing that we need to do is, as you talked about, elbow bumping being the new standard, because our hands are the dirtiest things, and washing your hands has been shown, at least with bacteria, to eliminate 95%. We know that both washing your hands as well as the alcohol reduces the number of virus, and just avoiding contact with people's hands is important.
Excellent. You've already kind of touched on what the hospitals are doing, and I can't let Oklahomans know how helpful they've been. Like you said, just kind of delaying elective surgeries. They're being really proactive with me as far as letting me know how many beds they have, letting me know what their surge plans are. So the medical community has been fantastic. The healthcare providers, the first responders. I just want to thank them. I just want to thank you, and thank you for your leadership and your organization. And the state is here to help you. The state's here to lock arms with you, and we're going to get past this. And so that's my message to Oklahomans, and we're going to take it. We're going to deal with it, and we're going to take all the guidance to try to mitigate this, so we don't have that influx into our hospitals and especially the most vulnerable population. So, Thanks for having me today, Larry.
Well, thank you for being here. We greatly appreciate it. I know all of our listeners appreciate it. I'm sure that, as I said, this will get spread out among various venues to more and more people. I know even our physicians have anxiety over this. Older physicians anxious on whether they'll get it. But I think it's important to let people know that we're now seeing it in younger people as well. It's not like originally thought that it just wouldn't affect them. We have a significant percentage in Italy of people under the age of 50 who are actually in the hospital because of this. So it's affecting everybody, and we all need to be responsible. I think that goes back to my 3 original points of communication, of testing, and self-responsibility, and maybe that should be number 1. With that, I'm going to say thank you to all of our listeners. I hope that this has been helpful. I thank Governor Stitt for his time. I know it's been difficult to squeeze in with all that's going on right now, but we do appreciate it. Absolutely. And I hope we can have you back again.
Anytime. I'd love it.
Thank you.
Thank you.